Hello everyone, welcome back to my channel One Step for a Small Dog with Dr. Padma Srinivas. Today we are discussing about most important topic frequent cold and cough in kids, their causes and management. In this video, I'll be answering all the common questions in the minds of the parents when the kids get frequently sick. Most of the parents are generally worried if the kid is having a low immunity when it frequently gets sick. When a kid frequently gets sick, it doesn't mean that the immunity of the kid is low. It only means that the immune system of the kid is practicing to fight against a new pathogen. There are about 200 different viruses known which can cause cold and cough in kids, and every type is undergoing multiple mutations. Every time the kid is exposed to the new strain, the immune system of the kid reacts and the kid might get the symptoms cold or cough and fever. Second question is, how frequently can a kid get cough and cold and still consider to be a normal? Up to 10 colds per year are considered to be normal for a kid. It is common that kids frequently get cold and the frequency can be as quick as every month. The chances and the frequency keeps increasing as the kid is more exposed to a group of other kids like at the daycare or the school or the playground. What are the symptoms and how could it be managed? And what is the right time to consult a physician or a pediatrician? Generally, every cold has three symptoms: blocked nose or the runny nose, the cough, and the fever. It is very important to note that most of the cold and cough are caused because of the viral infections. So, any of the antibiotics stand no use for these viral infections. As is an old saying, if treated, it goes in 7 days, if not treated, in a week. So, the home remedies and the management plays a vital role here. For example, for the blocked nose, we can go for nasal aspirators or steam inhalations. Cough stays with longer periods for 7 to 10 days at times. So if it is too problematic, we can go for the cough syrups or the home remedies will do the best. We will discuss the home remedies at the end of the video. Fevers, these are the first line symptom showing the immunity of the kid towards any infection. So it is very important to remember that fevers are not to be suppressed. They can be managed with the small medications, but it's better not to use a strong medication and suppress fevers, which might result in hitting the immunity of the kid. Small temperatures can be managed with cold sponging and by increased intake of liquids and more amount of waters. It is very important to note that kids generally do not eat in these conditions and it is very normal for the body. So they themselves will catch up eating once the body is set well. We can maintain the nutrition with the liquid diet or easily digestible. Generally, parents will be under a lot of stress and under a panic when kids doesn't eat for a longer time. So it can be considered that to be a normal for a kid not to eat much in these conditions. We should be managing the nutritional intake with the help of a liquid diet or a semi-solid or a small quantity at frequent intervals or considerable intervals. So when should we consider taking to a pediatrician or a physician? Most of these colds can be managed at home, though the kid gets fever or cough or severe cold. We should consider taking the kid to a doctor if there is a severe weakness in a kid even after the fever. In spite of recurrent viral infections and bouts of cold every frequent now and then, the kid should be active physically and mentally in between the two colds. When a healthy person is hit by someone when he's walking, he can immediately get up as quick as possible, if not hurt strong, right? In the same way, if it happens again and again also, if the person is healthy enough, he will be able to stand up any multiple number of times. In the same way, a kid, if hit with a new virus again and again, if he is healthy otherwise, and the immune system is properly working, in spite of recurrent frequent bouts of cold, the kid will be active mentally and physically in between the two colds. If unlike this is the situation, the kid seems to be a little weak even after the fevers, even after the cold, then it is considered to be taking to a doctor to check his immunity levels and other body physical examinations. Secondly, after the cold and cough sets down and fever sets down, if the kid frequently gets a small rise in temperature in the evenings or the night times without any other symptoms, and if this happens frequently before the hit of second cold, then it can be considered that something is going wrong inside and should be considered to be taken to a pediatrician. Generally, normal colds will not be involved with the breathing issue. If the kid is facing a breathing issue along with the cold and cough, or if the kid gets the breathing issue after the cold, cough, and fever are set off, then the kid should be considered taking to a medical checkup to rule out the possible bacterial infection superimposed on the viral infection. These frequent colds and coughs should be bothering when, if not setting off easily, but are leading to some other infections like the sinus issues or the ear infections more than thrice a year after every cold, then it's better to rule out for any possible allergies or asthmatic conditions in the kid. At the outset, as a parent, if you think the kid is not normal, otherwise, as a previous cold and cough in this heat of cold, then definitely, as a doctors, we are there to confirm the safety of the kid. Please reach out to the pediatrician or the physician. Unfortunately, it's a truth that, in spite of it being a simple cough and cold because of a simple virus, it might extend to a few weeks, even, yes, for a few weeks in few of the kids, because it initially starts with the congestion, then with runny nose, and then with the stuffy nose, and then extends to the throat, etc., and then a dry cough. And cough may also linger for maximum of 1 week to 10 days. Everything will be normal if the kid is otherwise active and eating properly after the body is set and physically and mentally comfortable in spite of the cough and cold, and no other overlying infections are there like breathing issues or some ear infections or sinus infections. So, even the world class pediatricians will generally try to avoid the antibiotics in these cases, though it's lingering a lot for a lot longer periods, and though it's worrying and we wanted to get rid of it. And so, the home remedies are the best indicated in these conditions, and which we are going to discuss now. The most favorite home remedy will be the perfect nature's anti-inflammatory, a perfect antimicrobial medicine, and that is available everywhere, and that is honey. Honey is the best for the cold and cough symptoms as it has a viscous nature. It gives a coating to the throat, and it also reduces the itching and irritation of the throat, and also it reduces the cough and also improves the immunity. The most important point here to remember is generally we not suggest the honey for the babies below 1 year. This is because the baby's gut is still considered to be immature to tolerate the botulinum toxin, which can be produced inside the gut of the baby from the spores which are present in the honey. After reaching 1 year, we generally considered the gut to be mature enough to tolerate the botulism toxin and thus reducing the risk of it. The next most miracle and the well known remedy is turmeric milk. I consider giving a 3/4 cup of warm milk with 1 spoon of honey in it and a pinch of turmeric every day at the bedtime. This helps the baby to get a better night's sleep, lesser cough duration, and it is a very good immune booster too. Then I suggest a immune boosting syrup which can be made at home. It is take a tea glass of water, to it add 1.5 inch of ginger and 4 to 5 crushed black pepper powder. Boil it to half of its quantity. To this, decant it, add 1 spoon of honey and half spoon of lemon. Provide this to the kid every morning on an empty stomach. This gives the perfect immunity and reduces the duration of the cough cold. Next is steam bathing. It helps all the kids and especially the younger ones and the babies below 1.5 year or 1 year who can't take the steam inhalation. How do we do this? Just on the hot water in the tub to how much maximum heat and close the doors, leave it for 15 to 20 minutes so the entire room is filled with the fog. Once the entire room is filled with the air, warm air, then get inside with the kid and let the kid breathe in for 10 to 15 minutes so that all the nasal airways in the throat and the other airways, the congestion is cleared and the kid gets a relief and easy breathe. For the kids who are capable of taking steam inhalation, along with the steam inhalation also does a lot of work. Please give steam inhalation every day, at least once or twice. So also we should give them the practice of washing the hands every time they are going to eat, though they are in the garden, at the play area or in the school or whatever. Just give them the habit of washing the hands before they are touching the mouth or the face and before eating. If not with soap and water, at least with the sanitizer. Just clean their hands or with the clean wipes and then ask them to eat, though it is a snack or a meal. Last but not the least, but most important, please, if you find your kid is not feeling well, just avoid sending the kid to the school so that they not infect other kids in the school. Coming to the homeopathy, homeopathy plays a very vital role in building the immunity and setting the vital power of the individual. It does miracles, especially for the kids and babies who are not still exposed to other medications. It is the most safest and least side effects causing medication and even the fastest in the most acute fevers and cough and cold. Being the safest and fastest, it can be indicated to all the kids, even in the infants and these babies. On regular uses, it avoids all the complications and builds in immunity and lessens the frequency and the duration of each cough and cold in the kid. It definitely prevents the stage of unnecessary medication of antibiotics, etc., and overlying infections. Few of the remedies like the roostox, which is indicated in the wet weathers, the dulcamera, which is indicated when there is a sudden change of climate, the belladonna in the fevers, Allium cepa in the warm weathers with a running nose and the tears, Rumex in the bouts of dry barking cough, Spongia in the dry coughs, and many others are a very good remedies for the frequent colds and cough in the kids. Hope this video gives you ample information regarding the regular colds and coughs in kids and has solved so many of your questions. Do consult the physician or the pediatrician when required. Signing off for the day, don't forget to subscribe my channel. One step for a small talk, and that's the way how we can get more about the fun, art and medicine. Please subscribe, share, like and hit the bell icon. Bye bye.